everyone. Today we are going to discuss about immunity. So what is immunity? Immunity is protection against infectious pathogen, and it also provides protection against the cancer, and it has significance in reaction against the tissue transplant and sometimes against the self antigen, which we will discuss in the autoimmunity. Broadly, immunity is divided into innate immunity, which is also known as natural and native immunity, and the other one is adaptive immunity, which is also known as acquired and specific immunity. So first we will discuss about the innate immunity. This type of immunity is present from the birth, and it has immediate defense system. What are the components of innate immunity? It includes surface epithelia like lining of the skin, GI tract, lung. They basically provide physical barrier to the pathogen. They don't allow the entry of pathogen inside the body. Other one is dendritic cells. They identify the pathogen and present them to the further inflammatory cells and ultimately result in removal and degradation of that pathogen. There are innate lymphoid cells. They are tissue resident lymphocytes. They do not have T cell antigen receptor. Some of the example of innate lymphoid cells are innate lymphoid cell type 1, 2 and 3. NK cells are also the part of innate lymphoid cells. They are the source of inflammatory cytokine during early phases of the immune reaction. Other components of innate immunity include neutrophils and monocytes. When monocytes enter into the tissue species, then they are known as macrophages. And here are some of the examples of the macrophages. Cooper cells in liver, microglia in brain, alveolar macrophages in the lung. What are the other cells play important role in innate immunity are mast cell, epithelial cells and endothelial cells. They release different cytokines and mediator to take part in the immune reaction or immune responses. We will discuss them in detail later on. Plasma proteins, for example complement system, C-reactive proteins and lung surfactant, they play important role in the immune reaction, particularly in innate immunity. These are the abbreviation we are going to use again and again. AG for the antigen, AB for the antibody, IG for immunoglobulins. Now we will discuss about the adaptive immunity. This adaptive immunity is also known as acquired or specific immunity. As the name suggests, this is an acquired immunity. So we develop this kind of immunity after birth, after exposure to the particular pathogen or particular antigen. What are the components of adaptive immunity? This is broadly divided into humoral and cellular immunity. In humoral immunity, B cell play an important role. B cell produce antibody after exposure to particular antigen, and these result in the immune reaction. In cellular immunity, we will discuss about the role of T lymphocytes. So in innate immunity, as we have discussed, epithelial barriers prevent entry of the pathogen by various mechanisms, and there are phagocytes, dendritic cells, complement and NK cells. These are the part of innate immunity which is present from the birth. or also known as non-specific and native immunity. And the other is adaptive immunity. B cell play part in the humoral immunity by producing antibodies against the antigen. And the other one is cellular immunity, which is mediated by the T lymphocytes. And T lymphocyte further differentiate into the T helper and cytotoxic T lymphocyte and result in subsequent degradation or removal of the pathogen.